Hi, my name is Abby, and I'll be talking about somatoform disorder and what we may encounter when dealing with patient with somatoform disorder and how might a parents feel about having a child with this disorder. What is somatoform disorder? A somatoform disorder is a group of psychiatric disorder that cause unexplained physical symptoms. And there are different types of somatoform disorder. There's somatization disorder. Somatization disorder is a chronic syndrome of multiple somatic symptoms that cannot be explained medically and are associated with psychosocial distress and a long-time seeking of assistance from healthcare professional. There's also pain disorder. The essential feature of pain disorder is severe and prolonged pain that causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. There's also hypochondriasis. Hypochondriasis is an unrealistic preoccupation with fear of having a serious illness. There's also conversion disorder. Conversion disorder is a loss of or change in body functioning resulting from psychological conflict, the physical symptoms of which cannot be explained by any medical disorder or pathophysiological mechanism. There's also body dysmorphic disorder. This disorder, formerly called dysmorphophobia, is characterized by the exaggerated belief that the body is deformed or defective in some specific way. And the signs and symptoms of somatoform includes pain, headache, joint, abdominal back, or chest pain, or any pain that you can feel in your body. They can also experience symptoms such as passing out, hallucination, loss of touch, pain sensation, double vision, blindness, deafness, and even seizure. The causes of somatoform can be genetic. Studies have shown that an increased incidence of somatization disorder, conversion disorder, and hypochondriasis is first-degree relatives, implying possible inheritable disposition. It can be also biochemical. Decreased level of serotonin and endorphin may play a role in etiology of the pain. And it could be also psychodynamic. Some psychodynamic view hypochondriasis as an ego defense mechanism. The psychodynamic theory of conversion disorder process that emotion associated with traumatic event that the individual cannot express because of a moral or ethical unacceptability are converted into physical symptoms. There's also family dynamics. Some families have difficulty expressing emotion openly and resolving conflicts verbally. When this happens, the child may become ill and shifted the focus, and it's made from the open conflict to child illness, leaving unresolved and underlying issues that the family cannot confront openly. There's also social, cultural, or familial factors. Somatic complaints are often reinforced when the sick rules believe that the individual from the need to deal with stressful situation, whether it could be with society or within the family. Another cause can be past experience with physical illness. Personal experience or experience of close family members with serious or life-threatening illness can lead into individual to have hypochondriasis. Also, cause would be cultural and environmental factors. Some cultures and religion carry implicit sanctions against verbalizing or directly impressing emotion states, thereby indirectly encouraging more acceptable somatic behavior. Some cultures are not really not very sharing comes to their emotions. The treatment for somatoform disorder can be medication to relieve the pain. There's also cognitive behavioral psychotherapy. The cognitive behavioral psychotherapy strategies may be specifically helpful in reducing the stress and high medical use. There's also psychosocial therapies. Psychosocial intervention would be a strong relationship between the patient and the person caring for the patient. There's also psychoeducation. Psychoeducation can be helpful by letting the patient know that physical symptoms may be exacerbated by anxiety or other emotional problem. But we just have to be careful of to resist suggestion that their condition is due to emotional or rather than physical problem. We must also assess individual with somatoform disorder by their history, such as detailed account of their previous physical problem or numerous diagnostic tests, and also numbers of even if they have surgical procedures. You can also look into the general appearance or their motor behavior, because most patients with somatoform they walk slowly and with unusual gait because of the pain or disability caused by the symptoms. They may also exhibit facial expression of discomfort or physical distress. We can also look at their mood, their affect. Most of their mood is often liable, shifting from seeming depressed and sad when describing physical problems, or looking bright and excited when talking about how they can go to the hospital in the middle of the night by the ambulance. We can also look at the thought process and the content. Clients or patient who has somatized do not experience disordered thought process. The content of their thinking is primarily about over-exaggerated physical concern, for example, their pain. Our goal for patient with somatoform disorder are for them to identify the relationship between stress and physical symptoms. They would also verbalize or express emotional feelings. It's always good to talk, and communication is always a key. Also, follow an established daily routine. You should also maintain your daily routine and still continue doing things for everyday living. They will also demonstrate alternative ways to deal with stress, anxiety, and other feelings. They would also demonstrate healthier behavior regarding having some rest, activity, and nutritional intake. Some intervention for somatoform disorder are providing health teaching. Some clients who has somatoform disorder doesn't really know that they have it or don't know what's causing the problem. They just most of them just think it's just a physical medical condition, but it's also sometimes it could be associated with a mental problem. So the nurse must help the client establish a daily routine and includes improve about health behaviors. And we need also to discuss the disorder and the possibility of the disorder with the patient. We should also assist the client to express their emotion. A client may keep detailed journal for their physical symptoms, and as a nurse, we should ask them to describe a situation at that time, such as whether they were alone or with others, whether also any disagreement were occurring, and so on. We should also start teaching coping strategies. We should also do emotion-focused strategies, include progressive relaxation, deep breathing, guided imagery, and distractions such as music or other activities. We should also do problem-focused coping strategies, which include problem-solving methods, applying the process to identify the problem, and role-playing interaction with others. The issues that we may encounter when treating a patient with somatoform disorder is the challenge in working with somatoform disorder is its primary care setting is to simultaneously exclude medical causes for physical symptoms while considering a mental health diagnosis. The diagnosis of a somatoform disorder should be considered early in the process of evaluating the patient with unexplained physical symptoms. Also, the ability to tell the difference between normal body sensation and those that signal harm. It could be very challenging for individual or family members and healthcare professional alike to tell if new symptoms relate to a major illness or a routine feeling of discomfort. And issues that can encounter when treating patient with somatoform is also that that tend to know at first they don't tend to know at first that what triggers the symptoms, and most patient doesn't know why they are sick, and that could be just a physical condition but turns out to be a mental illness, which sometimes it makes it hard for them to cope and understand the situation. Other issues is that they feel like there's no one out there who can understand what they are feeling, or there is no one in their inner circle has the same illness as them. Even their own parents or their family member doesn't know how to help them out with their situation because it's not physical condition, it's more of a mental condition. And how could a parent feel when caring for a children with somatoform? Any parents will find it difficult seeing their son or their daughter being not the same as they were before and having unbearable pain and not knowing what causing the problem or the pain. And it is hard to just to adjust to the situation, and sometimes it's hard to tell if the kid was just acting out or just wanting attention. It's also hard because as a parent, as any parent, you want to be strong and you don't want your child to see you vulnerable, but sometimes being vulnerable can help your child. It's kind of a way that you can tell to your child, to your kid, that I'm human too. I also face troubles as you face troubles, so they're not alone. And I think parents doesn't nowadays, even nowadays, with or without somatoform, parents are lacking on open communication with their children. And I think as a parent, they need to have an open communication with their parents, with their children, and just talk regularly. Because sometimes for patient with somatoform disorder, the children are not having the ability to openly say what they're feeling, so sometimes it's their body who will do the talking for them. And in our society, it's more easy to accept a medical diagnosis rather than a mental problem. So also mind and body can be connected. And that's it. Thank you.